Hi there, and welcome. My name is Calliope, and I'm going to be performing your medical massage today. So I saw in your chart here, I saw that you are seeking treatment for some temporomandibular joint dysfunction, as well as some neck pain. Is that correct? Okay. Would you mind just telling me a little bit about the neck pain specifically? Was there any sort of injury, or what do you have going on with that? Okay. All right. Okay, well, that gives me a little bit of a better idea. So, medical massage is different from regular massage because we have a goal in mind, right? We want to address pain, address dysfunction, limitations in the body, and ideally, we get you performing at a better level, if not at your normal level, or before the injury, before the pain, okay? So this process can be relaxing, but in and of itself, it's not like relaxation massage, right? So we use techniques like deep tissue. We can use muscle energy techniques. We can use trigger point therapy techniques as well, stretching, that sort of thing, lymphatic drainage even. So we'll use some different assessments, tests, to determine what's going on with your jaw and your neck issues. And then we'll get in and see if we can fix those up for you. Okay? All right. Do you mind if I just start by looking at your neck? Okay. So I'm going to have a little peek here, and we're going to do some testing. We'll look at your range of movement. We'll see if there are certain movements that might exacerbate the issue. So, is this pain all the time? Are there certain movements that make it better or worse? Okay. Okay. And how long has this been going on? I see. Well, I'm going to have you do a few things for me. We will do some active range of movement to start, and then we'll do some passive. So I'm going to have you just turn your head to one side, come back to neutral, go to the other side. Okay? And I'm just going to watch your range of movement. I'm going to watch your face and see maybe if you wince at something. Okay. Tell me about that movement a bit. Was there any particular point where you felt pain? Did you feel any restriction? Okay, can you just do that again for me one more time? Okay. Alrighty, now can we go up and then down? Up and down. Alright, and how did that feel? Okay, and last little movement here for just isolating the neck. I'm going to have you tilt your head, try to touch your ear to your shoulder. Likely not going to do that, but just try to get there. Do that a couple of times. Okay, and tell me about that. Just gonna feel the neck bit here. Okay. I see. So we're gonna get some other muscles and areas involved and see if maybe any of that exacerbates the issue. So if you could just shrug your shoulders and tell me how that feels in terms of your neck pain. Okay? And can you roll your shoulders backwards? And forwards. Okay. Can you lift your arms forward and then all the way? Good. And can you bring them backwards as far as you can go? Okay. Out to the side. Bring them up. And back down. So, did any of that play into the neck pain? Okay. All right, interesting. So, let's move on to the temporomandibular joint issues. So, let me take a little feel here. And tell me a little bit about this issue. When it started, how painful it is. Okay. Alright, so I am going to have you do a few things for me so we can assess this joint and the associated muscles of mastication. So if I could have you just clench the jaw and unclench, clench, unclench. Okay, now I'm going to come up to your forehead. This is where your temporalis muscle is, right in the temple area here. So if you could just clench the jaw, unclench, clench, clench. Okay, tell me about that. Okay. All right, now I'm going to have you open the jaw and close. Open, close. All right, and now I'm going to have you jut the jaw forward. It's going to look a little goofy, but what can you do? So we'll bring it forward. Okay, now you could go back, forward, back. Okay, can you move to one side and the other? Side, the other. Okay, so tell me what was going on there. All right, well, let's go ahead and just come back to the neck real quick, and we can do that passive range of movement testing. So I'm going to just take your head here, and I'm going to move it in those different directions that we did with the active range of movement. So I'm just going to have you let me take the weight of your head, and I will move you around. Okay. So we're going to turn, and just as this is happening, just tell me what's going on. Okay. All right, let's go ahead and go up and down, up and down. Okay, and let's go ahead and tilt, 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 and tilt. Okay, so how was all of that? All right, let me take a little bit of a deeper feel here. Really palpate into some of these muscle groups. So when we have the neck, we have a lot of muscles. We have a lot of muscles to deal with. We have trapezius on the top. We have muscles like levator scapulae, for example. We've got the scalenes, we've got the sternocleidomastoid, and we even have muscles like the intrinsic muscles of our back around our spine. So we've got our intermediates coming up into here. And then you have muscles in around the area. So rotator cuff muscles like the infraspinatus, supraspinatus. We have teres minor, we have subscapularis. And then in front of the neck, you've got your infra and suprahyoid muscles. It's a lot to keep track of. And with the jaw area, so we have very powerful muscles here. Masseter, we have the medial and lateral pterygoids deep into this area, and we have the temporalis. Sometimes these can get a little overenthusiastic and can really clench up and lock up, and they're very powerful muscles on their own. So if they go a little rogue, they can really cause some issues. So what I want to start with here, what I want to work with is going to be your TMJ area first, and then we'll get into the neck. So I want to start by just warming this area up, and we're going to really try to melt into these muscles. So do let me know if at any point you feel any pain or tenderness. This is an area that if you push a little too hard, it's just not going to respond to you, and it can just lock up even more. Do you happen to be a teeth grinder? Or do you grind at night, perhaps? Are you a clencher? Like when you're bored or when you're frustrated? Or doing it just unconsciously? Okay. Have you ever talked to a dentist about this at all? A lot of times they deal with the intraoral areas, of course, but sometimes the extraoral, and your TMJ can be a part of that. Okay. Yeah, they're the kind of people who would, for example, suggest wearing a mouth guard at night if you're really clenching or grinding your teeth at night. So I'm going to really try to work into these areas. We're going to start extraorally, and we are going to work intraorally as well. But I want to use both hands here to really get in here. And a lot of times this is an area that we can use the trigger point therapy to address the tension. And sometimes all it takes is some sustained pressure before the muscles start to unravel. And we're also going to send you home with some exercises. So that's going to be important to keep this issue from perpetuating. And it's going to help relieve some of the issue as well. Good. How are we doing in terms of pressure? Mm-hmm. Okay. That's good to hear. Alright, let's do a little bit of pressure work here. So I'm just letting my fingers kind of sink into there. And we're seeing if things open up a little or if they're still resisting. And when we work inside of the mouth as well, that's gonna be what we are gonna play with a little bit. Okay. So I'm actually gonna feel around a little bit up here, because this can be a contributor, the temporalis here. So we're going to see if maybe this wants to relax a little too. And even though these areas are very strong, they're also very delicate. I mean, the jaw, that joint can dislocate from even just yawning. And this area of your cranium, the sphenoid bone, that can be pretty delicate. So we just want to work with that in mind. Here we are. Okay. So that's actually not super tense there. So we're just going to keep on coming around this area. Good. And we'll press in. See if we can let that open up just a little bit more. And with all of this work on the outside here, it's really going to help our work on the inside. Okay. Alright, so let me go ahead and I am going to put some plastic around my finger here for going into your mouth. Yours truly is allergic to like everything, so gloves that aren't very noisy and flimsy don't really work very well. So I've got my little finger here. This is the only thing that will be going into your mouth. What I'm going to do is pressing right by your back teeth. We're going to be getting into that area back there. We're going to see if we can soften that up. Okay. So I'm going to have you open your mouth. And you can go ahead and just relax a little bit if you want. And I'm going to use my other hand to just steady everything. And we're going to just kind of warm up the area here. And we are going to just press in there. Have you enjoyed the rainy day so far? Yeah, it's kind of funny when we get these like little days of off and on drizzle. Sometimes like the moment it's just kind of spitting out, you get people mowing their lawn and you're like, ain't that bad for the blades? Like, what are we doing here? Lawns. I'm going to have you open your mouth here. So I am going to tell you that these areas are probably going to be pretty sore for a couple of days. Especially in here, you might get that kind of phantom sensation of someone pressing into that area. So just keep that in mind. It's more noticeable as opposed to like painful. And I'm just going to come into this side. And you can relax the jaw. And we'll get in here. Good. Yeah, the soreness was kind of an interesting thing. I've actually had this done before, and it does just feel like someone is just still keeping their finger in that area. A little strange, but not terrible. Okay, we're just gonna hold that there and see if that opens up. Okay. Right here. Okay, and just hold. Okay, would you mind opening your mouth? There we go. So we will get rid of that. Now, in terms of our exercises, these are pretty easy. So I'm going to have you touch your tongue to the roof of your mouth, but you're going to do a few tongue clicks before that so you know where to put it. So if you just go just like that, wherever your tongue naturally goes, that's where you're going to let it rest. So that will help keep a space between your teeth. It'll keep your jaw a little more relaxed and open. So just from time to time, if you go and just rest your tongue on the roof of your mouth to keep that space, that's going to help keep that area from clenching up. The other thing we can do, if you take your hand and make a little finger gun like this, you are going to go into the opposite side of your mouth. Your thumb goes on your canine here, where your other finger goes on the bottom of the back of your teeth. What you're going to do is basically hold open your mouth. So you'll have your fingers like this, your mouth will be open, and you're going to do that for about 5 seconds, and then take your hand out of your mouth and let it rest. Go back in and prop up your mouth for 5 seconds, come out and do it one more time. And then you do it on the other side. So it'll be pretty sore in here to start, but that is helping to relax the jaw, okay? So let's look at the neck. And we are going to do some warming up here to start. Just getting over in the neck as well as down the trapezius a bit, and we'll even come up into the suboccipital muscles as well, and just we'll just kind of get all over. And again, let me know if there's any pain or discomfort, because the muscles might lock up as opposed to letting me help soothe them down. Okay, and do let me know just in general if you feel a particularly tender spot, because I can work into that area a bit as well. I just want the tissue to be nice and warm, pliable. We can do some massage, but also some muscle energy is a really good technique for this area. A little bit of stretching maybe. How are we feeling so far? Okay, so I'm just gonna poke around a little. Tell me if there's just like that. Okay, so that's a little sore spot there. So we will work into here. We're gonna try to release some of these trigger points before we get into like the muscle energy technique, for example, because that might just aggravate things. So if we address it first, then it'll be less of an issue. Okay, how about right in here? Yeah, okay. Good. Good. How about in here? Yeah. We'll just get these little areas and we can do some more therapeutic work right in here. Let's do right here. It sounds like the rain started back up again. It's just these tiny little bits of rain. Right in here. Okay, so what muscle energy techniques are is very simply, we're kind of using your body's muscle strength, not against itself, but to work with itself. For example, if I have a restriction in my neck, what I can do is I can put a little bit of resistance right here and have the neck come right about here and then bring it back, and then we can turn our head just a little bit more and keep going, relax, and then we can go just a little bit more. And we're using the body's structure, the body's muscles to get through those restrictions just by using its own strength. So I am going to be holding onto your head here. And what I'm going to have you do, I'm going to have you try to move your head this way. Okay, I'm going to hold your head. And we're going to release. And hold. And release. Okay, and hold. And release. So we're using like 20 to 30% of our muscle strength here and just very slowly carving into that restriction. So just come here for a moment and relax. Hold. Relax. Hold. Relax. Okay. Just like that. Other side. Hold. Relax. Hold. Relax. Hold. Relax. Back to neutral here. Hold. Relax. Hold. Relax. Hold. Relax. Good. And I'm just going to move your head a little bit here. So I'm actually going to, we're going to do something a little goofy here where I'm just going to move your head right about here. Okay, and then I'm just going to move that right there. We're going to hold here for a moment. I'm just going to work in this area. Okay, and then we're going to bring your head here and then twist a bit like that. Work in here. Good. Okay, and we'll come right about here. Twist there. So it's all about just these little adjustments and getting the muscle in a different position. Make it a little more accessible to work with. Okay, right. Let's see if we can just do right here. We'll see this side. And we'll come right about here. Right in this side as well. Okay. So let me go ahead and just make sure your head is nice and secure there. Good. And we can just give it a little bit of a rest. Smooth everything out. Warm everything back up a bit. And since we had some exacerbation with some other muscles, I'm going to try to get in here as well. So we've got, for example, pectoralis minor can be a big one that is a problem when we have our shoulders pulled forward or hunched. And then we can also work around the shoulders as well, because all of these muscles, they're pulling on each other. They are lengthening, shortening, going beyond their normal boundaries. Sometimes they cause dysfunction that way. So if you have your shoulders hunched forward, for example, if you're someone who slouches, you're lengthening muscles past what they usually would be like, and you're shortening muscles that are supposed to be longer. So we can try to correct some of those structural issues so that we can lengthen the front muscles and shorten the back muscles. Unfortunately, the body just doesn't really have a manual for how you're supposed to do things correctly. It tries to work with you, it really does, but that doesn't mean that it does it very well. It'll make sure you're still functional. Not necessarily pain-free, though. How are we doing? Pain-wise? That's good. And have you felt any sort of tender spots at all? Okay. So in terms of medical massage, the frequency kind of depends on what you want to do and how well you respond. So we could do this twice a week. We could do it 3 times a week. It's akin to like physical therapy. And actually, we can use similar techniques to physical therapists. I'm just going to move your arm here. So it's really, it's what you feel will work well for you. I mean, if it's not really that big of an issue, we can do once a week, but I really like to start most people with twice a week. We can always add an appointment. We can always take away an appointment. But 2 seems to be a pretty good baseline. And that way we can get ahead of if patterns start to reestablish that caused the issue in the first place. And we can break those and we can establish different patterns. Give your body something a little different to try, something a little better. I'm just going to marry the 2 areas here. So in subsequent appointments, we will see if there was any regression, if there's any more pain, less pain, and then we can try to just go layer by layer. We can work a little deeper into things, spend more time on one area, get a little more comprehensive. Just depends on the appointment and what your body's doing, really. We might spend one appointment just focusing on the neck, maybe one on the jaw, one trying to get everything. We'll do little assessment check-ins frequently, see where we're at there. Okay. So the exercise that I want you to work on with the neck, what we're going to do is a variation of that muscle energy technique. So you would do this lying down, flat, no pillows. You could do this on the floor or on your bed. And what you're going to do is you're going to put 2 fingers on your temple, and you're going to use about 20 to 30% of your strength and push against your fingers to your full range of motion until your restriction, or until you go as far as you can. So it'll look like this. Come back, rest for a moment. Do this again. And again. And what we're aiming for to start is going to be 10 reps on each side. And that's going to help build up some muscle back here so that the weakened areas that make it easy to slouch forward, that make it more painful, we can build up these areas so that it's less easy to go back into those painful patterns. All right. So, did you have any questions for me at all? Okay. Do you think that we could start with the 2 appointments a week? Will that work for you? We're open pretty late usually. I think most days we're open until 8. So even if you work later, then that works. And we generally open about 7 to 8 a.m. Okay, so are there any particular days that work better for you? Okay. And any particular times that work best for you, and we can just make that an ongoing slot. Okay, we can do that. All right, I want to start, let's just conservatively here start for 3 weeks at this schedule, and then we can reevaluate if we need to keep up with 2 times or if we can go to once a week until we have this all resolved as much as we can. Okay. All right, well, it was an absolute pleasure working with you, and I hope that together we can address this TMJ and neck pain, get that all fixed for you. I hope you have a whale of a day and a good rest of your night. Thank you. Thank you so much for watching. I really appreciate it. And a big thank you to my patrons on Patreon, without which I wouldn't be able to make these videos. If you want to help support the channel, there is a link to my Patreon in the description box below. I offer perks like ad-free access to videos, early access to videos. We have Patreon exclusive videos. We have audio downloads of all my videos.